You guys remember Raven-Symoné? She was on
That's So Raven.
That's So Raven. And before that, she was on the Cosby Show.
I love That's So Raven.
So she actually has a podcast now, and she was very open just recently about the fact that when she was a teenager, before the age of 18, she had a couple of plastic surgeries, which is kind of crazy. You don't hear that very often.
For what?
So that's a great question. So she actually had 2 separate episodes of plastic surgery. I think the second one, I'm sorry, the first one.
I could see a breast reduction.
Boom, you nailed it. So she had a breast reduction.
She was a pretty voluptuous gal.
She had a breast reduction pretty early on, so like mid-teens. And then as she continued to grow, she had to go back and have a second breast reduction, which that's pretty unusual. And we're gonna talk about that.
She was like a child star on Disney Channel. So I'm sure it was like, I guess that's kind of distracting.
I mean, it is for sure, and especially being somebody who's in the media or in entertainment, like that would be a potential issue. But she did have very large breasts per her report, and in her mid-teens she decided to have a breast reduction, and I'm gonna talk about that in a minute. And then she ended up having a second surgery where she had a repeat breast reduction, and then she also had some liposuction.
Yeah. Which
that one I think is a little bit. More questionable. I mean, I'll dig into that in a second. But she reports she did have lots of issues with weight, and she had some hormone imbalances, which that makes total sense. I mean, most girls who go for breast reduction do have either increased estrogen or increased sensitivity to estrogen, and that's why their breasts grow so large. So I did a little digging on plastic surgery in teens, and so in 2020, which is the last year we have some good data, there was actually 87,000 teens who had some form of plastic surgery. Now, the majority of that was 18 and 19-year-olds because they're adults and they can do what they want. So the actual number of people or kids under the 18 that have plastic surgery is pretty low. The majority is going to be your 18, 19-year-olds if you're talking about people under 20. The things that most commonly they have, you said it, breast reduction is way up there. Rhinoplasty is actually up there too.
A lot of girls in my high school were like, "Oh, I'm gonna get a nose job whenever I graduate high school."
Yeah, I mean,
I think it's kind of like a good idea of like that time of your life to do it because like you go to a brand new city.
Right, and nobody knows you.
And nobody knows you.
It's not a bad thing. I'm as always, I'm kind of the middle ground person. Like, I'm not the person that's like, oh yeah, bring your 16-year-old daughter in for me to do liposuction. Like, I'm absolutely against that. But on the other hand, if somebody has an issue that is affecting their life truly, and that could be something like very large breasts, or the other is like
your ears.
The ears, right? Ear pinning.
You know who has some large ears that she's self-conscious about?
Who?
Kylie Jenner.
What?
You just don't ever see it because of her hair.
I didn't know that.
Mm-hmm.
I'm gonna have to go look now.
Yeah, she has.
I've never noticed that.
Her ears poke out, and her hair is always like this.
I have noticed that she always has her hair like that.
Her hair's like always just like that.
All right, I'm gonna have to look.
She talked about it.
So breast reduction, otoplasty, which is the ear pinning, and then rhinoplasty are the big ones. So and all of those I can like get on board with. Now, what have I done on on people under 18? I've definitely done breast reductions. I've done breast symmetrizing procedures. There are some syndromes where girls will not develop a breast on one side and they will on the other. And then as they get into their teen years, that becomes really awkward where they basically have like a C cup and absolutely flat. And so to me, that's not like an augmentation, although that's how you would fix it is by doing an augmentation. I don't consider that like a cosmetic surgery. So I'm happy to do that, versus I wouldn't do, if somebody brought in their 16-year-old daughter and wanted them to get a breast aug, I would pass on that.
Yeah.
To me, it's like it's not an absolute surgery they have to have. Make them wait till they're 18, personally.
Yeah. Get more brain cells before you do that.
At least a little bit more mature, right? Yeah. So, but you do have to kind of consider what are the downsides of even doing these surgeries at those ages. And I was really interested to see that Raven-Symoné had 2 breast reductions because, and this is something I counsel people on when they come in to me for breast reductions as teens. And when I say teens, I'm talking less than 18.
Yeah.
Is, are you fully developed and are your breasts completely grown? Because, if they're not and you do a breast reduction and you continue to gain breast tissue, then you could in a situation like Raven-Symoné did where you actually have to have a second breast reduction. And would it be better to just do it all at once? I mean, I think that's a personal question, meaning a case by case, because, for example, if somebody came in at 14 and their breasts are so large that they can't wear clothes properly or they can't do any sports whatsoever, I mean, I would be really prone to do the breast reduction even if I thought that they might grow afterwards, because it's going to be such a huge life-changing thing.
Right.
And so I do think that there are reasons why you would absolutely want to do plastic surgery procedures on
I wonder
kids.
when she got that, because I feel like endocrinology is like really big right now, especially like getting your hormones accurate and getting them like.
The thing is that
where they need to be.
I don't think there's any really good treatments like hormonally for macromastia or really large breasts.
But it could have helped her, like the doctor be like, hey, but maybe she already knew this going into it. Like if a doctor was like, yeah, we'll give you this breast reduction, but you might have to have it again.
I would hope that the surgeon would have said that to her.
Yeah.
I mean, because I know that I do that, when I have patients that are younger. So, but yeah, I think it's interesting to kind of think about, what surgeries teens might be having, and is it a good idea or not? I am against like just doing flat out cosmetic surgery on teens. Like I just feel like you should be an adult, you should be able to consent for the surgery, and it's just maybe in my opinion not a great idea to do something that major on somebody who's not an adult. So,
right. I agree.
Yeah, but interesting. So let me know your thoughts. What do you think? Plastic surgery on teens, good idea, bad idea? I'm against it for the most part, except for the situations that I spoke about. But you might have a different opinion. Let me know what you think.